Good afternoon. Today I will be talking about snake bite. A 35-year-old female patient living in a rural area. She had gone to the field and she had sudden pain in the legs, and she thought she has been bitten by some organism, probably snake or a scorpion. And by the time she was hospitalized, she had developed mild ptosis and weakness of the limbs. And on examination, if you see this photo, you will see typical fang marks. So this is definitely a case of snake bite, which is followed by some neuroparalytic complications. And if neuroparalytic complications occur following snake bite, they are usually because of bite by snakes which come in the Elapidae family, which means cobra and krait. And we will discuss about snake bites in my talk. India is considered to be the capital of snake bites. Why? Because snake bites occur very commonly in India. These are totally preventable, and about 2.8 million snake bites a year occur in India alone, and about 45 to 50,000 deaths occur because of snake bites. Therefore, snake bite is an important public health problem, totally preventable, and more than 2 lakh reported cases of snake bite occur annually, of which about 35 to 50,000 die, and this constitutes the highest snake bite mortality in the world, in any country. We know snake bites typically occur in rural and peri-urban areas. Snake bites are particularly common in poor people who walk barefoot in the fields, or they go for outdoor defecation and in the fields. And particularly snake bites are more common in monsoon, when the snakes come out of their bill, and we always get patients of snake bite after the first shower, as soon as the monsoon starts. But one should remember that that very few species of snakes are actually poisonous. Therefore, there is an urgent need to prevent death due to snake bite in India, and we should understand that anti-snake venom and its rational use is the only definitive treatment for snake bite. There are 4 very important snakes which cause mortality in India, medically important snakes which can cause about 99% of deaths because of snake bites occur because of these 4 types of snakes. First is the common cobra, that is nag. Second is common krait. Third is Russell's viper, and fourth is saw-scaled viper. Cobra and krait belong to the Elapidae family. Russell's viper and saw-scaled viper belong to the Viperidae family. Cobra and krait belonging to the Elapidae family cause neuroparalysis, whereas Viperidae family snakes, that is Russell's and saw-scaled vipers, they cause mainly hemoglobinopathy. They cause mainly the hematological involvement and bleeding manifestations. So these are the 4 of the more than 200 species of snakes. Only 50 are poisonous. Now, common cobra and common krait, which belong to the Elapidae family, they present with neurotoxic and they cause neuroparalysis. Most common is ptosis, and if you examine the eyeballs, the eyeball movement is impaired, that is there is external ophthalmoplegia. There is difficulty in swallowing, that is dysphagia. These are early manifestations of systemic envenomation. This will be followed by flaccid quadriparesis, weakness of all 4 limbs. neck muscle weakness, inability to hold the necks, and very important is patients may develop respiratory paralysis, which can become fatal. And therefore, all patients who have snake bite, one should always test for ocular movements, see for ptosis, and also test for weakness of the respiratory muscles. Impending respiratory muscle paralysis can be tested by a simple test which is called single breath count, in which the patient is asked to take a deep breath and count as much as he can in one breath. Just like we play kabaddi, 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 and we have to say it in one breath. Similarly, we ask the patient to take a deep breath and count. A normal person in one breath can count up to 25. But in patients who have respiratory muscle paralysis, this may be reduced. And before overt respiratory paralysis becomes clinically manifest, one can always get subclinical involvement of respiratory paralysis, which can be picked up by this simple bedside test of single breath count, asking the patient to take a deep breath and asking him to count as much as he can in one breath. So always do that test. C for eyeball movement, C for ptosis, C for muscle weakness, C for paralysis of the limbs. These are manifest, and C for the fang marks. So these are common manifestations of cobra and crate. The difference between cobra and crate is that cobra also causes local swelling and necrosis at the site of the bite, whereas crate produces no local manifestations and may be painless. We know in villages patients sleep on the floor, and I have seen a patient who has snake bite being bitten by a snake on the back, and fang marks could not be seen as nobody examines the back. And therefore, it is very important that any patient who presents with weakness and pure motor paralysis of muscles and ptosis, ophthalmoplegia, always ask history of snake bite, being bitten by someone, some organism, some insect, or by the snake. And also, many patients may not give that history, and therefore we have to search for fang marks, and these fang marks may be present in the back and where you don't usually examine. Another patient which I had seen of snake bite who presented with respiratory muscle paralysis was that the patient had gone to the field for defecation, open air defecation, and the snake had bitten the scrotum. And when he was examined, the scrotal swelling was present. So it's very important to search for fang marks and local swelling on a patient who presents with suspected snake bite. But it is also important to understand that crate bites produce no local swelling manifestations and may even be painless, and this may be confusing. So local symptoms and signs that may fang marks, local pain, local bleeding, local bruising, lymphangitis, local lymph node enlargement, everything can occur in patients with snake bite. Now, coming to the differences between the two types of snakes in the Elapidae family, that is the cobra and the crate. Cobra usually bites during daytime, crate bites in the night. Fang marks are very easily visible in cobra and may not be visible in the crate. And the onset of symptoms are early in cobra while late in crate, where neostigmine is effective and not effective in crate. And of the two, cobra and crate, cobra is nag, and this is the picture of cobra and crate here, you can see that. And it is the crate which has higher mortality as compared to cobra. Now these are the manifestations which can occur. You can see here ptosis here, local swelling, this is the crate, and weakness of the limbs can occur. Viperidae on the other hand causes consumption, coagulopathy and vasculopathy. Coagulation is impaired and therefore bleeding manifestations can occur. They are hemotoxic and they are also vasculotoxic. Hemotoxic means they affect the coagulation system, and vasculotoxic means they are damaging the vessels and can lead to spontaneous bleeding, which can lead to, and therefore one should always look for bleeding manifestations, like patients may have bleeding in the conjunctiva, bleeding may in the gums, or may present with epistaxis, and this should be always looked for in patients who have been bitten by snakes in the Viperidae family. And these patients also may develop local swelling because the snake venom, which also is myotoxic, and because it is myotoxic, it can cause damage to the muscles, and that leads to what is known as rhabdomyolysis, that means damage to the muscles, and that leads to release of myoglobin, which is filtered by the glomerulus, and that results in myoglobinuria, and that may lead to acute renal failure. So, acute renal failure is a manifestation of some patients of snake bite. Similarly, patients can have respiratory paralysis, may require admission to an intensive care setting where the patients may have to be put on a ventilator. Similarly, patients may require dialysis because these patients may develop acute renal failure with elevated serum creatinine and blood urea. So, in addition to these manifestations, patients will have local swelling due to the presence of cytolytic and necrotic toxin, which is present in the snake venom. Some of the Russell's viper bites from South India may produce neuroparalysis, but remember that Viperidae basically, that is creates Russell's and saw-scaled vipers, Viperidae, they basically cause hemotoxicity and cause vascular toxicity. Neuroparalysis is a manifestation of snakes in the Elapidae family. Now, this is a late manifestation of a person who has been bitten by a snake. You can see so much extensive damage to the muscles, and which has gone nearly bone deep. One should also understand that patients may develop may not develop any symptoms following snake bite, though bitten by a snake which is poisonous, cobra or viper or krait. Some of the patients may not develop manifestations. These are called dry bites. Now, what are dry bites is that if the snake actually has the ability to amount of toxin to be, amount of venom to be injected during the bite, that can be controlled. This venom is present in the salivary glands over the and this amount of venom can be injected, can be controlled by the snake. And if the snake has bitten another person or has bitten 2 or 3 people previously, this patient, if he is bitten by the subsequent, when the fangs are totally empty, no venom is injected, and therefore no clinical manifestations of toxicity would be present, though the patient has been bitten by a poisonous snake. These are called dry bites. Now, anti-snake venom is the only definitive treatment for snake bite, and it acts by neutralizing the circulating venom in the blood and tissue fluid. Now, this anti-snake venom is produced by immunoglobulin purified from the serum or plasma of horse or sheep that has been immunized with venom or one or more species of snakes. There are 2 types, monovalent, which neutralizes venom of one species, and polyvalent, which neutralizes the bites of 4 major types of snakes which found in India. In India, we do not have monovalent, and therefore, we should have only polyvalent, and I will talk about it subsequently. The snake bite protocol: if a person comes with snake bite, we have to follow this right first aid. Reassure the patient, because patient is very anxious. If he has been bitten by a snake, he feels that he is going to die, and therefore we should reassure the patient that he is not going to die. 70% of snake bites are from non-venomous snakes, and we need to tell them that there is a treatment for this snake bite as well. We have to immobilize that area which has been bitten by use of bandages or clothes to hold splints. Do not apply any tight ligatures. GS tends to get to the hospital and tell the doctor. It's very important that we should not interfere with the snake bite wound. We should not give any incisions. We should not do any rubbing. We should not vigorously clean the place where the snake has bitten. We should not massage. We should not apply any herbs or any chemicals. Light cleaning with soap water can be done under tap water. And we should not give any incisions. We should not because that will increase the absorption of venom and local bleeding. Therefore, do not give incision, do not rub, do not do vigorous cleaning, do not massage, do not apply herbs and chemicals. This is the rapid assessment. A, B, C, D, E is what is done always in all critically ill patients. This is done when the patient is critically ill. We should see that the airway is patent, breathing or respiratory movements are normal, blood pressure and pulse are normal, and is there any disability of the nervous system, level of consciousness, paralysis, exposure to environmental control. This is the routine thing which we do for first aid in patients assessment in patients who are critically ill. We have to give tetanus toxide. This is given intramuscularly, and this is to prevent tetanus, which is done routinely. We have to, since there is pain at the site of snake bite, we may have to give paracetamol, that is 500 to 1 gram, which can be given 4 to 6 hours. It is better to avoid non-steroidal anti-inflammatory agents because these can cause damage to the liver and the kidneys, and mild opioids like tramadol may be used. It's very important to avoid tying a tourniquet, which has been a practice previously. A tourniquet is tied proximal to the bite, so that it is tied and pressure is given in such a way that it will cause obstruction of the veins, and therefore the blood or the venom which will not return to go through the vein, and the arteries are spared. So tourniquets actually should not be tied. This should be avoided. And this is a wrong practice which is strongly discouraged, and as per the WHO norms and recommendations, tourniquets should not be tied, they should be avoided. So these are some no's which have to be very important to know what not to do. Many patients in the rural area actually go to a tantrik or जादू उतारने वाले के पास जाते हैं. That also should be discouraged. Patient should report to a center where this facility of giving anti-snake venom and is available, and also patients then, if they develop some respiratory paralysis or they have some bleeding manifestations, should be referred to a center where ventilatory facilities and dialysis facilities are available. Pressure immobilization method, a light bandage is tied, immobilization helps, and this is how you can actually immobilize the limb which has been bitten. This helps in reducing the absorption. This is a snake bite first aid pressure immobilization method which can be done in any center. One other very common test which can be done is what is known as the 20 WBCT. WBCT stands for whole blood clotting test, in which we have to take 2 ml of freshly sampled venous blood in heat dried glass vessel. We have seen this type of glass vessels which are always available in all hospitals or primary health centers. Just take 2 ml of blood and put it in this sterile glass syringe, a glass vessel, and leave it undisturbed for about 20 minutes. After 20 minutes, just tilt the vessel once. The blood should be clotted. But if you find that it is not clotted, that means the patient this test is positive, and that is an indication that the patient should be given anti-snake venom. But you should also remember that the test is invalid if the blood is collected in a plastic or glass vessel, or it is cleaned with a detergent. That will interfere with the test. So very simple test, does not require any reagents. Simple test should be done. Single breath count basically for patients and neurological examination for patients who are been bitten by LAPD group of families like cobra and crate, and 20 WBCT for patients who have been bitten with viperidae where it will be elevated. So 2 simple tests should be done in all patients who have been bitten by a snake. As I've said, polyvalent, the advantages are we do not have to waste time to identify the exact nature of the venomous snake is less expensive, and it is available, freely available. It is cheap. And this is only available in India, so there is no question. But and disadvantage, of course, is that there is increased incidence of allergic reaction because it has been produced from horse or sheep serum, and therefore anaphylactic shocks and allergic reactions are more common with polyvalent anti-snake venom than with monovalent anti-snake venom. Monovalent, on the other hand, is not available in India. It is available in some Western countries where it has increased efficacy and lower incidence of allergic reactions. And we but need to identify the exact nature of the venomous snake is mandatory, more expensive, and it is not available. So there is no need of discussing this monovalent here in India. So indications of, there are three important indications of anti-snake venom, because anti-snake venom, there are problems of availability, affordability and accessibility, and one whole dose of anti-snake venom cost nearly 10,000 rupees, and the bites, as we know, are more common in poor or rural population who cannot afford it, but now government has made it available in the primary health center. So local envenomation of more than half the bitten lip within 48 hours of the snake bite, where there is local swelling affecting nearly half of the bitten lip. Or if there is any evidence of neurotoxicity, that is single breath count is positive, or there is ptosis and ophthalmoplegia is present, or there is weakness on the limbs, definitely one should go ahead. Or even if the single breath count is slightly decreased, we should go ahead with giving anti-snake venom. Or there is 20 WBCT is positive, there is evidence of hemotoxicity. That means there is some evidence of bleeding, that is subconjunctival bleeding, or bleeding in the nose, or bleeding in the gums, or bleeding in the skin, which is manifested as purpura. If this is there, then the patient, and the 20 WBCT is positive, that means after 20 minutes the blood is not clotted, then that is a definite indication of giving anti-snake. So anti-snake venom is given when there is local swelling, there is evidence of neurotoxicity, and there is evidence of hemotoxicity. And WHO recommends that the initial dose of polyvalent anti-snake venom is 100 ml, which is equivalent, that is one vial actually contains 10 ml. So for snake bite, whether it is hemotoxic or whether it is neurotoxic, and if there is an indication that is swelling is present and there is hemotoxicity or neurotoxicity, one should give anti-snake venom. We have to dissolve 10 vials, each vial contains 10 ml. So 100 ml of anti-snake venom, which is polyvalent, it is dissolved in 200 ml of normal saline, and it is given intravenously slowly over a period of half an hour. But it's very important to understand that when we give anti-snake venom, we do not do sensitivity testing, but these patients can develop anaphylactic shock when the anti-snake venom is given, and which can be fatal. And therefore, it is very important that we have to keep pre-filled syringe of adrenaline, which is the drug of choice in patients who have developed anaphylactic shock. So before giving anti-snake venom, one should check the emergency tray and have a pre-filled syringe of 0.5 ml of 1 in 1000 dilution of adrenaline, and pre-filled syringe is there, so that it can be, if anaphylaxis occurs, it has to be given 0.5 ml, has to be given intramuscularly. So there is no need of skin testing. We don't waste time doing that. But we have to take precautions to tackle anaphylactic shock and treat it immediately if the patient develops it. The dose, therefore, first dose is always, if there is an indication of anti-snake venom, is 100 ml dissolved in 200 ml of normal saline given over half an hour. And then in case of hemotoxicity, we have to do the assess after 6 hours, again do the 20 WBCT, that is whole blood clotting time. If it is normal, then we can stop giving anti-snake venom. But if it is prolonged, that means it is positive that it is not clotted after 20 minutes. Then we have to give anti-snake venom, 5 to 10 vials have to be given immediately. And if that is after about a total dose of 300 ml is achieved, then we can stop giving ASV. So the total maximum dose which is there for hemotoxic snake bite is 30 vials, that is 300 ml of anti-snake venom. For neurotoxicity, we have to give immediately 10 vials, that is 100 ml dissolved in the 200 ml of normal saline, given slowly over half an hour. Assess the neurological and cardiovascular signs after 2 hours, 1 to 2 hours. Here we don't wait for 6 hours as is seen with hemotoxic snake bites. But if there is a deterioration in neurological manifestations which occurs with cobra and crate, if there is deterioration, we have to repeat anti-snake venom 10 vials. So maximum dose which is to be given for neurotoxic is 20 vials, that is 200 ml, whereas for hemotoxic it is 30 vials, that is 300 ml. So, and there is no adjustment for weight. Even if an infant comes who is very low body weight, comes with a snake bite, he should be given the same dose. So, dose is not dependent on body weight, dependent on age, but it is given to neutralize the venom which is injected in snake bite, and therefore we have to, the dose is standard. These are the WHO recommendations. Now, one should understand that patients can develop early anaphylactic reaction, and which can develop in 10 to 80 minutes, and bronchospasm and hypotension can occur, or they can develop minor reactions like fever, rigors, and late reactions like serum sickness. Patients can develop fever, nausea, vomiting, diarrhea, urticaria, arthralgia, immune complex nephritis. These are rare late complications which can occur. But the most dangerous is early anaphylactic reaction, and one should be prepared to treat anaphylactic reaction by seeing that we have a pre-filled syringe of adrenaline 0.1% in 1 in 1000 solution, and 0.5 milligrams have to be given intramuscularly immediately. We can also give AVIL like chlorpheniramine maleate 10 milligrams or IV hydrocortisone 100 milligrams. This can be given, but these are not life-saving. The life-saving is adrenaline. There has been a controversy of high end versus low dose, but no universal consensus. But it because the problems of availability and affordability and accessibility of anti-snake venom, and because it is expensive and always short in supply because it is prepared from horse or sheep serum, it is many times short in supply. In that situation, there have been protocols where low dose has also been effective, but what I have told you is the standard dose recommended by WHO. The snake bites occur more common in rural people living in remote areas who are poor and who have myths, and they often seek treatment from traditional faith healers. This should be discouraged, and these patients should receive anti-snake venom in the dose which I have described. In patients who have neurotoxicity, we can do the neostigmine test. What we do is we give 1.1 milligrams of neostigmine, 5 injections every half hourly, and if the patient improves, single breath count improves, that is all which we do. But there are other protocols also, and this neostigmine actually helps in patients who have cobra bites but not crate bites. So this is all about snake bite, and thank you for a patient hearing. If there are any questions, I will be happy to answer. Thank you very much.